Health problems will come. X39 helps to prevent some of those health problems. Introducing innovation in regenerative health technology. X39. Listen in as the doctor explains.
We're so excited to have Dr. Leland Stillman here at your best year ever virtual convention. So everybody welcome him. Woo!
Thank you for having me.
Super. Dr. Stillman, can you please tell us really what caught your eye with the X39 product and the technology? Really, what was the zinger that kind of was like a game changer for you and an eye opener?
So I became fascinated by light as medicine must have been 2017. And I dove deep into all the papers on this, started looking into devices that were tens or $10,000, $20,000 is basically what it was starting, right? And then there were devices up to $100,000 like red light therapy beds, like the NovoThor. Great product, incredible outcomes, an incredible whole new world of medicine, but unfortunately very impractical for the average person. It took a lot of time out of their day. Frequently they had to go somewhere to have the therapy done. Sometimes it was expensive on top of that, and then you're driving, you have to go multiple times a week. This was an opportunity I saw very quickly for me to deliver light therapy to people while they were at work, while they were at home, while they were indoors, getting on with life, right? Yeah. And so I knew immediately that it actually took a fair amount of prompting though from Renita Brannon, who we all know, for me to really take a look at it and then start using it in my practice. People are so inundated with information. There's so many products that are being sold. Unfortunately, a lot of them will say, I don't want to try this, I'm going to go do something else. But the key is the value is there. And that was immediately what I noticed when I started to actually recommend it. And then also what I did for my own peace of mind, really, was to put out a link in my blog posts and my email newsletters to a survey. And immediately the surveys we started getting back, reviews were incredible. Wow. Right, and so I spend a lot of time counseling patients on diet, lifestyle, exercise, all these things. We put them on complex supplement regimens that are hundreds of dollars a month oftentimes. And I was getting the same results in many cases with something as simple as a patch, like the X39, that I would otherwise be having to recommend hundreds of dollars in supplements or potentially medications in order to get the same outcome. So very limited, even with very limited experience with it, it was already very clearly very powerful. The science behind it made sense to me, and so then we just started recommending it to practically everyone.
That is some great, yeah.
And did you hear how he said that the reviews, so that would be testimony, came in like off the chart, like he's having
right away
great results with the patch compared to maybe doing supplements.
Yeah.
That's
or his other therapies that costed tens of thousands, sometimes upwards hundreds of thousands of dollars.
Oh yes,
incredible.
Yeah.
Particularly like stem cell therapy. We talk about that all the time because it's related. Yeah, I mean, people are sadly a lot of them look at the sticker price of the LifeWave X39 and they think, wow, that's a lot of money. Yeah. But the reality is with the outcomes that people get, you then ask them, well, would you rather spend $5K on a stem cell injection therapy protocol that you can't use for years, that happens once and then maybe you don't get good results from, or you don't get any results from? Because that happens, right?
Right. Exactly.
And that's what is $5,000? That's a low end for stem cells. I mean, you could get low. 10, 20, 30. Yeah. So then it's just a simple math.
Let's give everybody, Dr. Stillman, can you explain exactly in simple terms how the X39 works? So
our bodies emit a certain amount of infrared light. So infrared light is light we can't see. We sense it as heat. So when you go outside on a sunny day and you feel the warmth of the sun on your face, what you're really sensing is the 42% of sunlight that is in the infrared part of the spectrum, okay? What people don't realize is that infrared light fundamentally runs a lot of their biology under the hood. And they don't realize this because, we don't come with an owner's manual or instruction manual, so you have to kind of figure it out as you go. But quite literally, your mitochondria, the powerhouses of the cell, they make energy in the form of heat. They make infrared light. This interacts with water in the cell to create energy. So the X39s reflect a very specific frequency of light back into the cell that has a specific effect of turning on and off key, I'm going to call them bioregulatory pathways right? But biochemical pathways and,
Right.
and so on and so forth. And that's how they work. So, you know, you asked me to make sure I made it simple and understandable.
Yeah.
It's real simple. These patches reflect your body's light back into the body at a very specific wavelength for a very powerful therapeutic effect.
By the way, as a former pro athlete for 25 years, not one team doctor, not one doctor that did my 14 surgeries, none of my therapists, or I've been to 37 physicals since I've been married. Gina's had me at 37 physicals, right? So she must have wanted me to stick around. Not one doctor has said, Steve, you know, as you get older, your stem cells become dormant. No one has told me this until I heard of this X39. So tell us a little bit about stem cells, what they are and why they need to remain active, because I didn't know they were going to go dormant.
Yes. So stem cells are cells that can grow, and then what we call, the word we use is differentiate into other types of cells. I want you to think about it in terms of like, you could take dollars in your checking account or a credit card and you could go out and you could buy anything. You could turn it into whatever you needed, right? You could turn it into a car, you could turn it into a house, you could turn it into a shed, you could turn it into tools, you could turn it into LifeWave patches. Whatever you want to turn it into, you can turn it into that, right? But at the end of the day, if you don't have any cash in the bank, how do you turn your car into money for groceries, right?
Yeah.
So the body has this finite number of cells that we call stem cells, and the stem cells themselves become anything you need. You need new heart cells, they become heart cells. You need new brain cells, they become brain cells. You need new hip cells, new joint capsule cells, new bone cells, new muscle cells, new whatever cells, those stem cells become those cells. They're all over your body, they can travel through your circulatory system. And the thing about stem cells is they, as you mentioned, they go into what we call senescence and they begin to run out as we get older. This is part of the aging process, right? And so the name of the game really of anti-aging and regenerative medicine might easily be summed up in keeping as many stem cells around for as long as possible and keeping them as powerful as possible.
Here's a great question to help everybody here with their doctor, or if there's a doctor listening, okay? Dr. Stillman, as an MD, please explain to other doctors and medical professionals who have never heard of X39 why they should take this technology serious.
They should take this technology seriously because it works. It's very cost effective for the results that it gets. It can actually provide them with more time for themselves, for their families, and most of all for really good patient care. Because one of the challenges we face today is that patients need a lot of time, they need a lot of education, but you know, people will balk at spending a lot of money on medical consultation. And this allows physicians, part of why I'm able to do so much content production now, we have tons of videos going out on YouTube and Instagram, and we have things going out on Twitter, we have lots of social media going. Part of that is because we have income streams from things like LifeWave that then allow me to essentially offer free education to the public about how to be healthy and well. And that then allows me to not just see patients all day, which frankly is burning a lot of doctors out. It's why so many patients are complaining about the quality of medical care. The doctors are tired. So it works, it's cost effective in the long run. It's a great revenue stream for a practice. And the other thing is it will get people results, oftentimes even if they don't do anything else. I have to be very protective of my reputation, right? Because in the end, people come to me because they trust me.
Yeah, absolutely.
Right? So for me to endorse this product, I have to be very sure that it works.
What about some of our friends that are getting involved and they ask us where to put the patch?
I think people just keep it simple. You know, put it right over the big first vertebra that sticks out of your neck and your back.
There you have it. Get back to the person that shared this presentation with you.